Also tonight, a multi-million-dollar hospice fraud scheme has unraveled.
Among the accused, 76 doctors, 23 pharmacists, and 19 nurses who are charged for their roles in prescribing and distributing addictive painkillers.
Corrupt doctors here in LA scamming billions for patients that don't exist and care they never provide.
Also tonight, a multi-million-dollar hospice fraud scheme has unraveled. Among the accused, 76 doctors, 23 pharmacists, and 19 nurses who are charged for their roles in prescribing and distributing addictive painkillers. Corrupt doctors here in LA scamming billions for patients that don't exist and care they never provide. 5:12 a.m. Miami, Florida, April 11, 2026. $31 million seized. More than 120,000 counterfeit pain pills distributed into the healthcare system. A network worth $470 million just exposed. A hospital executive arrested. 29 nurses detained. 47 other staff members now under federal investigation. Not criminals operating in the shadows, but licensed medical professionals working in hospitals, trusted with human lives, now accused of turning healthcare into a system of deception. In less than 90 seconds, FBI and ICE agents breached a private hospital complex, valued at over $18 million, securing all entry points, locking down internal systems, and cutting off all communications before any records could be erased. Controlled medications had been replaced, patient records altered, entire treatment plans falsified and executed under official authorization codes. This was not medical error, not a mistake. This was a coordinated criminal operation embedded inside a functioning hospital. And what agents uncovered within those walls would reveal something far more disturbing than counterfeit drugs. Because this network did not just distribute fake pain medication, it turned patient trust into profit on a massive scale. If this level of corruption sends a chill down your spine, make sure to like and subscribe, because what started as a silent raid in Miami is now unfolding into a full-scale federal investigation into a counterfeit drug network that may extend far beyond a single hospital. FBI SWAT made several arrests in relation to healthcare fraud, accused of stealing millions from taxpayers. They're accused of submitting almost 1,000 claims based on a fake diagnosis, costing taxpayers about $30,000 per patient. But what most people do not realize is that this operation almost went undetected. At exactly 5:45 a.m., the silence across several upscale neighborhoods in Miami was shattered, as more than 280 federal agents launched a series of coordinated raids. Not just at one hospital, but across 12 connected medical facilities, privates, and distribution centers. This was not a routine arrest. This was a large-scale systemic takedown. It marked the peak of a federal operation now internally known as Operation Silent Dose, a multi-agency strike targeting a protected network of licensed medical professionals operating under legal authority. By early morning, the FBI had dismantled a criminal structure tied to Dr. Stephen Maroff, 29 nurses, 12 pharmacists, and multiple third-party providers, all accused of pushing more than 120,000 counterfeit pain pills into the healthcare system, generating over $31 million in illegal revenue in just 3 months. They did not use force to rob people of their property. They used prescriptions. They used federal billing codes. They exploited patient trust to carry out the theft of hundreds of millions of dollars directly within the U.S. healthcare system. The scale was staggering. Across Miami-Dade County, Alabama, and South Carolina, task forces moved in complete silence to lock down data before it could disappear. Inside a key pharmaceutical hub in Georgia, investigators uncovered a synthetic drug distribution center, operating like a commercial-scale trafficking network. This was not a pharmacy. This was a smuggling pipeline built to push counterfeit drugs into the healthcare system without detection. Evidence collected at the scene showed the network was processing and distributing more than 8,000 pills per day. Many of them were labeled as FDA-approved pain medications, but contained completely unknown chemical compounds. For patients, this was not care. This was danger disguised as treatment, and every 24 hours it generated more than $1.2 million in Medicare fraud. The DOJ says people manufactured, sold, and shipped millions of counterfeit pills to people who thought they were buying real medications. At the core of the federal indictment was a chilling disregard for professional ethics and human dignity. In the United States, hospice care serves as a critical lifeline for millions of patients, especially the elderly. It is built on trust, absolute trust, and prosecutors allege that this network exploited that trust for profit. Investigators also uncovered patient records at the Palm Ridge facility, showing that more than 68% of individuals receiving these medications had no verifiable medical necessity for the prescribed dosages. In several documented cases, patients reported worsening conditions, ineffective pain relief, and severe side effects. But they were never told the truth. Inside the system, they had been marked as terminal patients because on the surface everything appeared legitimate. And that was the most dangerous part. If you think this is the worst of it, it is not. Stay with me because what they uncovered next will expose something far bigger than counterfeit drugs. This organization did not rely on chance. It relied on recruitment. According to federal investigators, a structured pipeline had been operating quietly across Miami for more than a year. Unlicensed marketers were sent into low-income neighborhoods, senior housing communities, and outpatient clinics posing as healthcare assistants. They offered free consultations, discounted prescriptions, transportation services. But in reality, they were not helping patients. They were collecting data, names, insurance details, prescription histories, every piece of information needed to feed the system. For every patient profile submitted into the network, recruiters were paid between $300 and $800 in illegal commissions. Inside the hospitals, nurses and administrative staff would process these files, pushing them through internal systems as legitimate cases. Doctors did not need to examine the patients. In many instances, they never even saw them. Electronic approvals were issued in bulk. E-prescriptions were signed within seconds, and once those approvals went through, the operation was activated. Counterfeit pain medication entered the system. Patients were prescribed drugs they believed were FDA-approved treatments. In reality, many of these pills contained diluted compounds, incorrect dosages, or substances that had never undergone clinical testing. The network billed these prescriptions through private insurance and federal programs, charging between $120 and $450 per prescription cycle. Individually, the amount seemed small, but at scale, the numbers became staggering. More than 120,000 counterfeit pills were pushed through the system. Over 8,000 prescriptions were processed each month. At its peak, the operation was generating an estimated $2.2 million in monthly cash flow. This was not random fraud. This was a deliberately engineered pipeline. But as FBI agents dug deeper into the financial records, they uncovered something far more troubling. Inside luxury vehicles linked to hospital staff and hidden compartments behind reinforced walls in private clinics, investigators discovered vacuum-sealed bundles of cash, encrypted ledgers, and transaction logs pointing to offshore accounts. The $31 million generated from counterfeit drugs was not sitting still. It was moving fast, quietly across borders. This was no longer just healthcare fraud. This was covert financial infrastructure. According to federal prosecutors, the money was routed through shell companies disguised as medical equipment suppliers, then broken into multiple transactions, often ranging from $100,000 to $150,000 each to avoid detection. From there, it was transferred into international accounts across the Caribbean and Southeast Asia. Once offshore, portions of the money were reinvested into expanding distribution operations, securing new supply chains, and scaling the counterfeit drug trade across multiple cities. As the initial shock of the arrests began to settle, a far darker reality emerged from the forensic data. This was not just a group of greedy doctors padding their bank accounts. This was a sophisticated money laundering operation designed to bridge the gap between legitimate federal funding and illicit underground capital. The deeper, more dangerous phase of the investigation had shifted from medical facilities to the shadowy intersection of healthcare and international drug trafficking. But another layer began to surface. Logistics vehicles registered as medical transport units, storage facilities labeled as pharmaceutical warehouses, supply routes that were licensed but never questioned. Investigators now believe that the same network used to distribute counterfeit medication may also have been capable of transporting other controlled substances without detection. In reality, the parallel structure between street-level drug trafficking and counterfeit pharmaceuticals had evolved into a system of corporate-scale profit, a dual-use system. On one side, it drained millions of dollars from patients and insurance providers. On the other, it created a protected corridor for illegal distribution under the cover of healthcare operations. Perfectly disguised. Who would suspect that a hospice transport vehicle supposedly carrying terminally ill patients could also be moving high-grade narcotics? The luxury lifestyle built from this $500 million scheme was deeply corrupt. When IRS criminal investigators traced the digital footprint of the suspects, they uncovered a pattern of spending that went far beyond typical medical salaries. We are talking about luxury vehicles worth more than $180,000 registered under nonprofit medical organizations. Waterfront properties in Miami Beach valued at over $9 million purchased through shell companies traced back to offshore accounts in the Cayman Islands. A senior nurse reporting an annual salary of just $110,000 was found maintaining a travel schedule filled with back-to-back stays at five-star hotels in Dubai, Milan, and Singapore, all funded by illegal commissions tied to the approval of fraudulent prescriptions. But the most disturbing discovery was not the money. It was the system they built to decide who mattered and who did not. Federal investigators uncovered an encrypted internal database, a ranking system. Patients were not categorized based on medical urgency, but on profit potential. Those with high-value insurance were marked as priority. Repeated prescription approvals increased their value. Meanwhile, individuals with limited coverage or genuine medical needs were quietly pushed out of the system. In some cases, patients were kept on ineffective medications for months, not because they needed treatment, but because it generated revenue. Others reported increasing pain, worsening conditions, and unexplained side effects. But inside the system, everything appeared compliant. Every procedure was signed, approved, processed. Doctors were not just ignoring patients. They were avoiding them. They wanted names. They wanted numbers, but had no intention of spending even a single minute providing care. The $470 million was pure profit because their operational costs were nearly zero. No real medication was purchased. No legitimate nurses were hired, and no actual equipment was used. It was a hollow system designed for exploitation. A network of ghost hospitals built to funnel money from patients and insurance providers directly into the hands of a criminal organization. FBI financial crime units froze more than 73 bank accounts linked to the suspects, seizing approximately $18.6 million in liquid assets. But even that figure represented only a fraction of the total. Tens of millions more had already been moved, converted into cryptocurrency, or routed through informal financial channels designed to bypass traditional banking systems. An informal money transfer system often used by international criminal organizations to evade the oversight of traditional banking networks. This had become a war on two fronts: a fight to stop the erosion of the U.S. healthcare system, and a desperate race to trace drug money before it disappeared forever. Investigators were no longer just looking for fraud. They were uncovering a new kind of criminal drug doctors, individuals who exploited the credibility of medical credentials to conceal the identity of a narcotics trafficker. As the federal government finally moved in, the focus shifted from the tactical precision of the raids to the catastrophic failure of the systems designed to prevent them. The final phase of this investigation exposed a regulatory gap in Miami that allowed this multi-million-dollar operation to grow unchecked for years. The boldness of the 42 defendants was not driven by greed alone. It was fueled by a calculated belief that no one was watching. Prosecutors now reveal that the state oversight system was not just slow, it had effectively stalled. Legislative deadlines for hospice care reform in Sacramento were allowed to expire, creating a dark zone where criminals and even incarcerated federal inmates could obtain medical licenses and operate healthcare facilities without interference. The legal fallout from the arrests triggered a wave of intense public outrage as 42 doctors and nurses appeared before a federal judge in Miami. The true cost of their betrayal was laid bare. These were individuals who had sworn an oath only to trade it for a place within organized international crime. Federal prosecutors are now seeking maximum sentences not only for financial theft, but for the moral collapse at the core of this conspiracy. Under federal sentencing guidelines, many of these defendants now face prison terms ranging from 30 years to life. Charges of healthcare fraud, conspiracy, and money laundering are being enhanced by aggravating factors tied to alleged connections with drug trafficking. The message from the Department of Justice is clear. The white coat will no longer serve as a shield for a criminal heart. The financial recovery effort is becoming one of the most complex cases in the history of the IRS. Although agents have seized more than $150 million in tangible assets, including fleets of luxury vehicles, mansions in Glendale, and offshore accounts, a significant portion of the $500 million remains missing. Forensic accountants are now tracing a web of cryptocurrency transactions leading into Eastern Europe and Southeast Asia, suggesting that these so-called medical profession mold this is not just a local scandal in Miami. It is one link in a much larger underground financial network. The government's effort to recover taxpayer money has become a race against time and technology. As digital traces fade with every passing hour, but beyond the money in the prison cells for thousands of patients across Miami-Dade County, hospitals are no longer places of safety. They are now places of suspicion, places where prescribed medication may not heal but instead cause harm. Federal investigators have launched a comprehensive audit across more than 60 licensed medical facilities, directly or indirectly connected to this network, a process that could take years and may uncover even more hidden operations. Federal task forces have signaled that this is only the beginning. What started as a targeted raid is now expanding into a broad purge across the entire healthcare sector. The federal government is making it clear that any medical professional who places profit above patient care will ultimately face consequences. For now, 41 primary suspects remain in federal custody, medical licenses suspended, careers erased, reputations destroyed within hours. But the damage they caused cannot be undone. More than 120,000 counterfeit pills have entered the market. Thousands of patients have unknowingly received compromised treatment, and the entire system is now forced to question itself. This is a new era of crime, one where medical credentials are used as cover, where prescriptions become tools of exploitation, where the line between healer and criminal disappears. This represents a blatant violation of the social contract, when doctors and nurses, the very people we trust with our lives in our most vulnerable moments, choose to align themselves with drug traffickers and professional fraudsters. The foundation of our justice system begins to shake. Operation Silent Dose has sent shockwaves through the medical community, proving that federal authorities no longer view health care fraud as a harmless economic crime. They now see it as a national security threat. As 41 defendants await final judgment, this case stands as a harsh reminder that greed has no professional boundaries. These were not desperate individuals. These were wealthy, educated professionals who decided that $500 million was worth more than their conscience and the safety of the public. The consequences of this investigation may lead to the most aggressive overhaul of medical licensing laws in Miami's history. But for the thousands of patients who were exploited as pawns in this deadly ledger, the damage has already been done. Their medical identities have been compromised and their trust in the system has been permanently broken. We will continue to follow this case and the pursuit of millions of dollars still circulating within the global underground economy. This case proves that the most dangerous criminals do not always wear masks. Sometimes they wear surgical gowns. If you found this in-depth analysis of the case useful, make sure to like the video and turn on notifications. We do not just report headlines. We expose how crime operates in the shadows. Stay alert, stay informed, and thank you for watching. We will see you in the next part.